Hello, my name is Dr. Ebi. I welcome you once again to this channel, Beyond the Consulting Room, where I talk about issues that concern your human dignity and well-being. In this video, I want to talk about how your mind or your thoughts can affect your physical health or your body, and how your body or physical health can affect your mind, a situation we call the mind-body connection. So we believe that the mind and the body should not be seen as separate entities, but they should be seen as if what affects one can affect the other. Okay. Now, if you have heard about the white coat hypertension, whereby in some people, not in all cases, some people come to the hospital, they get their blood pressure measured, and then we think that their blood pressures are slightly elevated because of the environment. So if we had measured at home or in a more relaxed environment, that person could record lower blood pressures than what was recorded in the health facilities. So in some cases, when the blood pressure is just marginally elevated, not so high, in some cases, not in all cases, we have to let this person go and do blood pressure monitoring, what we call a BP profile. Go and do this BP profile at home, do a home blood pressure monitoring, or get the blood pressure monitored in a more relaxed environment outside the hospital setting. All right. Now, what is accounting for this person's blood pressure increasing in the health facility? It is the fear, the anxiety of being in an environment that the person considers as scary. Okay, so this is the case of a fearful thought or anxiety or something going on in the mind manifesting as a raised blood pressure or manifested as something that is going on in the physical body. All right. Sometimes when people are anxious, the person is going for an interview, that person can experience some anxiety. So the person's hand, maybe before the person is called for the interview, the hand is shaking, the palms are sweaty, the heart is beating faster. You could have a situation whereby the breathing rate is faster than normal. Sometimes the person experiences this slight stomach upset as if he or she wants to visit the washroom or even wants to urinate. Okay, that urinary frequency you experience during anxiety, during the stomach upset during anxiety, or the shaky hands, your sweaty palms, all these are happening in the physical body, but they are as a result of fearful thoughts. Okay, so the mind can affect the physical body or physical health. All right. In some cases, also, you have people who are embarking on some projects, some stressful projects. Let's say somebody is bereaved, the person is organizing a funeral, for instance. You could find that person developing a cold, all right, or a flu, or maybe some cold sore or herpes on the lip. Sometimes herpes can result, maybe sometimes it is infectious, but in other times, this herpes virus or the herpes infection on the lip is because of a reactivation of the herpes virus that is latent, that is sleeping, that is dormant. Okay, it's because the person's immunity is weakened. All right. So the cold sore you have on your lip, the cold, that is the catarrh or the flu you have because of the weakened immune system, all these things are examples of how a psychological stress can affect your physical health. All right. You could also have the other way around, whereby your body or your physical health could affect your mind or your thoughts. Now, the reason why we're able to use medications in treating mental illnesses is because we have hormones or chemicals in the physical body we can modify. Hormones such as serotonin, for instance, can be modified, okay, with medicine in the physical body, and you can use that to treat mental illnesses. Okay, because we believe that some of these hormones affect your mind. All right, so this is your body physical happenings or things going on in your body, or chemicals in your physical body affecting your mind. We know that exercise improves your mood. All right, exercise is something you engage in physically, but we know that it improves your mood. So your body is affecting your mind. There are people who have some chronic diseases or some chronic pains, and because of that, they are thinking negative. They have worrying thoughts and disturbing thoughts. That is something happening in the physical body that is affecting your mind. Okay, so you could have your mind affecting your body or your physical health. You could also have your physical body or physical health affecting your mind. All right, but in this video, my concern mainly is about your mind or your thoughts affecting your physical body or your physical health. What usually happens in what we call stress, okay, whereby fearful thoughts, whether this so-called fear or threat that you see, whether it's perceived, okay, or whether it's imagined or whether it's real, you think that that's a threat to your life, and so the body must prepare or must be prepared to fight this stressor or to run away from this stressor. And it will need some changes in the body. So some hormones will be released, the stress hormones, cortisol, epinephrine, or sometimes we say adrenaline, and they are released to marshal resources and prepare the body to fight or to run. Okay, so your heart will be beating faster, you'll be breathing a lot more faster, your muscles become tensed, so you can fight or you can run. Okay, and non-essential organs are shut down, okay, during this stress response. But once the threat is over, or you have fought that stressor or you run away from that stressor, that should be it. All right, you have a relaxation response where everything returns to normal. All right, but where the stressor is there all the time, it's something to do with most of the time, all the time. It's like it's part of your life. It's like a lifestyle. Okay, financial issues and so many other problems. Then you have this long battle of always having to fight or having to run from the stressor, and then that is when you see the negative effects of stress more on your physical health, because you don't experience this moments of relaxation where hormones go back to normal levels, and then your stress response goes back to your relaxation mode. Okay, so then your blood pressure really doesn't come back to normal because you are always stressed. Okay, then again, your muscles are tensed most of the time because you are in the flight or fight mode most of the time. So the muscles around your neck, your head area, becomes tensed. You might have some headaches or bodily aches that are from this tensed muscles. Your immunity could be reduced or depressed because your bile cells, the function of your bile cells are altered because of this stress. Okay, so all that is going on now is because of the thoughts, the mind. Okay, you thinking there's a threat on your life, whether it's perceived or real, that threat is taken seriously and is affecting your body, okay, and manifesting as negative health. All right, so in this sense, negative thinking and emotions are considered as health hazards. So positive thinking and emotions are considered as healthy behaviors. Okay, healthy behaviors. So when you have negative thinking and emotions, these are negative health habits or negative health behaviors. Okay, so you don't see positive thinking or positive emotions as just for the purposes of making you feel good. You see them, positive thinking and emotions, as preventive health strategies. Okay, now before I talk about how to achieve a relaxed mind from psychological stress, I need to make the important point that stress is not compulsory. Why? Because stresses are neutral. And it's not everybody that is going to be afraid of dogs or snakes. Okay, there are some people who eat snakes. So what scares you does not necessarily scare somebody else. We handle different situations. The same situation, two different people will handle them differently. Okay, so stress is not compulsory. All right, so you don't have to feel stressed. You don't have to have psychological stress. Okay, so how do you attain or achieve a relaxed mind? All right, how do you deal with psychological stress? I would suggest two main methods. One is external and one is internal. The external methods are something we are very used to. We call them relaxation techniques or mind-body techniques. Anything that you can do that can relax your mind, whether it has to do with listening to music, dancing, singing, meditation or scriptures, prayer, massage, exercising, going out on a vacation, whatever you can do to relax your mind. Okay, you can do that once it is legitimate and it's appropriate. Okay, but the challenge with the external methods are that you might have to move yourself from one place to another. Going on a vacation, for instance, you might have to spend some money. So anytime that you are stressful, you have to go and spend money and move yourself to another place to release stress. That is not too nice compared to the second method, where you deal with psychological stress internally. So in this sense, you are using your mind to create your mind. You are using your mind to create a relaxed mind. Okay, you are choosing your thoughts, you are choosing what you think about, you are choosing how you think. All right, and this is very preventive. You don't wait till you get into that state of psychological stress, then you are looking for a place to relax, or you are looking for something to relax you. But when you use the internal approach, where you are using your mind to create a relaxed mind, it means that you choose what to think about. All right, with the assumption is that the human being was not created with a negative mind. In fact, when you are born, all right, you are not born with a negative mind. Okay, we know that genes can manifest in your mental processes, in your emotions, but we also know that your environment plays major roles in the expression of your genes. Okay, so your environment plays a lot of role in giving you a negative mind or a negative mindset by what you see, what you hear, what you read, what you experience, and so on. All right, but the good news is that you can choose what to think about. So whatever there is to think about, whether you're thinking about life and life problems in general, you're thinking about other people, you're thinking about yourself, you're thinking about God, whatever you think about, you can choose to say that negative thinking and emotions are health hazards. So I choose not to think negatively. And positive thinking and emotions are promoting my health in a positive direction. So I am going to choose to think positively because of its positive impact on my physical health. Okay.
Presenting 4 life-changing books by Dr. Abraham Amponsah. Positive Health, Health Beyond Pills. Becoming the best version of humanity. What you need to know about medical checkup. The right treatment for the right disease. Visit www.drab.org for your soft copies, and for your hard copies, call or WhatsApp 0548 696904.